Okay, so I'll go ahead and start so we're not waiting that people come in later. So let me share my slides. Oops. Okay, so good morning, good afternoon, good evening, depending on where you're watching from. And thank you for joining us for today's event. My name is Adriana Bankston. I'm currently the CEO and managing publisher for the Journal of Science Policy and Governance. And I want to provide a brief background on JSPG for those who may not be familiar with the journal. So we are an internationally recognized open access and peer-reviewed publication. We're established 10 years ago by senior leaders and young scholars in science and technology policy. And our mission is to catalyze the engagement of students and early career researchers in science policy and governance debate through policy research and writing. We publish policy papers from students, postdocs, policy fellows, and early career researchers in science policy. And through the journal, we also bolster their research and writing credentials in science policy and encourage them to engage in policy discourse and debate and to contribute to policymaking at all levels of government. We publish OPEDs, technology assessments, policy memos and analyses, white papers, book reviews, workshop proceedings, and other research articles that cover every corner of science and technology policy. We also promote the publications through our global mailing lists and events, such as workshops, webinars, and a podcast where we interview published authors. You can follow JSPG on Twitter, Facebook, and Instagram. We also have a YouTube channel where we post all of our recordings, and I'll share all of our channels a little later. So on to today's topic. We currently have a call for papers open on strengthening youth-centered policy and governance and digital transformations in health with a deadline of August 21st. The special issue is sponsored by the Lancet and Financial Times Commission on Governing Health Futures 2030, Growing Up in a Digital World, or GH Futures 2030. This webinar is the third in a series of events meant to help inspire and empower prospective authors with expert perspectives on digital health, which can inform their submissions to the special issue. So just a few logistics for the event today. Please mute your microphones and turn off your videos. During the panel discussion, you can ask questions in the chat to our speakers. You can send them directly to me or to our moderator in the chat. For some brief background on the event, this webinar is focused on policy developments to promote human rights in the digital environment, involve youth in designing health policies, and unlock the shared public value in health data while increasing trust among individuals, health providers, and governments. We have a distinguished panel here today, and thank you all for your participation. I'd like to just briefly introduce them before I turn it over to our moderator. So first we have Barbara Prainsack, who is the head of political science department at the University of Vienna and chair of the European Group on Ethics and Science and New Technologies, advising the president of the European Commission. Joe Ricard is a master's candidate in responsibility in science, engineering, technology at TU München. Andre Risch is a director of health systems, medical products, and innovation at DJ Sante and also GH Futures 2030 commissioner. And finally, Marwa Azelmat, who is a digital health expert at R&W Media. So now I'd like to introduce our moderator for today. Shalin Jyotishi is the former CEO of JSPG and now senior advisor. By day, Shalin is a senior analyst, writer, and strategist at New America, a fellow at the World Economic Forum, leading research on the future of work, and a visiting scholar at the American Association for the Advancement of Science. I'll share a link to Shalin's bio for more, but I'll stop here for now and turn it over to Shalin, and thanks for moderating today.
Thanks so much, Adriana, and thanks so much for all of our attendees for tuning in. We're really excited to have this conversation with our esteemed panel today. I'll give a little bit of just background comments that might inform your writing for this call for submissions. I have the privilege of having ties to the journal as well as the commission. And for me, I'd see the opportunity to publish in this call for papers as a really meaningful opportunity to contribute youth and early career perspectives to all dimensions of digital health related to the Commission's work. So I'm really excited about this partnership. I'm thrilled that we're having so much interest from early career researchers from around the world of all sorts of disciplines, of all backgrounds, to drive the future in a co-design manner. We're going to dive into our conversation, and I'm going to structure it by asking our panelists some questions, drawing on their expertise. But before I do that, I'd like to turn things over to our panel to give them a chance to share a little bit about their perspectives that they bring to this conversation as framing for our conversation today. I'm going to start in order that Adriana went in during the introductions, and I certainly hope everyone will tune in on Twitter and share out findings for those who couldn't join us live today. I'm going to start with Barbara for opening comments, and we'll move on from there. Thank you. Barbara, on to you.
Thank you very much, Shalin, and thank you to everyone for having me. So why am I here? I think the main reason is because, well, my research group and I, we've done a lot of work on data governance in the last couple of years. And in particular, we are now having the privilege of working with colleagues at the Governing Health Futures Commission on what we call data solidarity. So for those of you for whom it might be relevant, what is data solidarity and why we need it? Well, I think one big challenge is that the issues that we're dealing with in digital societies, in particular connected to digital data and digital practices, we are trying to address those issues with instruments from the paper age. So what do I mean by that? For example, one of the things we're dealing with is, and I'm not telling anyone anything new here, the accumulation of power by corporations, by entities that are not publicly accountable in the ways that governments have been, and governments are, and public bodies are. So it has led some people to wonder whether democracy has lost primacy over technology. Another issue is that the benefits and also the harms that accrue in digital societies by digital practices are benefits and harms that accrue for groups that are sometimes different from those people who gave the data. So harms and benefits are systemic, and these kinds of problems cannot be addressed by just, increasing control that individuals have over data. Increasingly, we need systemic collective solutions. And this is exactly what data solidarity is trying to do. It's trying to complement the focus on individual control by increasing collective oversight, collective control over digital practices in the widest sense of the word. And just to conclude, how do we do this? And if anyone is interested, I'm very happy to give you more details later or offline. So there are three main pillars of data solidarity. One is that we're trying to find ways to make it easier for data to be used where they create public value. So at the moment, it's sometimes very difficult to use data for public value, whereas it's much easier to use data for private profit making. The second pillar is to also improve harm mitigation mechanisms, because where there are benefits, there will be harms. So how can we support people who experience harms? And then the third pillar consists in finding ways in which profits that are made on the basis of people's data can be shared with the very people and communities that enable the profits in the first place, because the data are created by communities, by people, by us as patients, as citizens. So how can some of those profits be shared? So this is it in a nutshell. And again, I'm happy to say more later on.
Thank you so very much, Barbara. Jyotishi, on to you for some opening comments.
Hello, thank you very much for having me. Yes, my name is Jyotishi. I'm a student now. I study responsibility in science and technology. And I was very interested into joining this discussion because, well, it is youth oriented and I have been involving in youth initiatives because I think it's a very important step for inclusion and also for empowerment of people that are not just the future, but also the present. And in this specific topic of health data, I think, well, having just passed through a pandemic, I think it's a very important topic, but as well, like all the innovations that are coming in these decades and in the next years, as well as the governing processes, how can we make a bridge between these innovations and governance are like very important questions, I think. So that's why I wanted to join the discussion.
So grateful to have you, Jari. Thank you. Next up, Marwa, for framing comments.
Thank you, and thanks everyone for having me here today. I think, well, I currently work on digital rights per se, but I guess that whether digital rights or working on health data or working on governance, we must kind of just ensure that we look at the entrenched system of inequalities where these kind of breaches happen, whether for data, whether for human rights, whether for other rights. At the end of the day, when we talk about public value, we need to talk about public value and what does it mean for different communities and different experiences. And I think that's why having young people or other structurally marginalized communities from the get-go is really important to understand what trust really means, because we live in a times of democracy erosion, and trust is even more not granted, not given, and it's really hard to just assume that people are reaching their full potential, or that it's a one-size-fits-all kind of approach. So yeah, I mean, I just want to really focus today on how does the governance system, when it's good, it just doesn't happen in a vacuum. And so we need to really ensure that we look at the different angles where a lot of people are, again, structurally marginalized by the systems itself that we have designed, without really ensuring that they don't replicate and reproduce inequalities. Yeah.
Thank you so much, Marwa. Your comments really resonate with me, being based in Washington, D.C., as conversations of the January 6th uprising are very top of mind for us. Thank you. Next up, we have our GH Futures 2030 Commissioner. Andre, on to you for opening comments.
You know, what brought me to the commission was basically the interest. You know, what's going to happen in next years, and I felt, you know, when we started, the things are moving relatively slowly. This compared to my appetite for digital health development. But then suddenly COVID came, and seems like many puzzles started to come together. And I'm coming here also as a regulator. I do regulation on the EU level, which is one of the, I think, important jurisdiction in the world. And we just finalized and proposed the 3rd of May complex regulations called European Health Data Space. Barbara mentioned a number of principles. You know, we have to pull together. And we try. We put this also in the preamble of this legislation. We developed a number of technical ideas, but I think what's really I learned during this process, that coming back to other speakers' points, that the regulation, of course, is important, but what is important, the way we explain, you know, the whole ideas to the patients, to the citizens, to the community of healthcare professionals, because this new area of our life, it's boosted by COVID, is understood better than it was before COVID. It's opened many new doors and complex solutions. But I think we still miss many pieces of especially in the concept of trust, concept of solidarity, of data, concept of what is health and then how my health can be helped by this new era of change. So a lot of things to be seen. I hope in this panel we have a chance to look for the future.
Absolutely. A through line I noticed across all of our opening remarks is how best to maximize the benefits of the digital health space while mitigating the risks that are associated with it. Brilliant. We're going to dive into our questions now. I invite folks to engage in the chat, converse with one another, converse with the panel, ask your questions, and it will go in our queue for when we get to our discussion portion. Excited to be with you all today for this conversation. My first question, Andre, builds on your comments and is for you. The commission's report put forth a key recommendation on building a public trust architecture for digital transformation of health. Could you briefly provide the audience with information about what this architecture means and why the commission believes it's a key recommendation for moving policy forward in responsible fashion?
You know, we had long debates, how to shape this concept, and of course, the best if you go to the report and see this chapter on governance and human rights and ethical principles, because this is the complex world of you, as you see the picture in the report with the slices of how we see this. I think is important to go back to this and see on the base we should keep a clear vision of the human rights, equity, democracy, already mentioned by Mama, solidarity principles, how we understand in this specific concept of digital world, because it's not always the same when we speak about, I say, analog world. I think Barbara mentioned this, and when we speak about the digital world, and what is different. So this is the first kind of base for this, and then we move to the way we manage this concept, how we build the transformation to the universal health coverage, how we improve the access and quality of health services, for example, because this is basically what can happen, what we can build on. For example, the question of access to health services was a big issue, because we studied a number of papers, also sharing our own experience, and COVID again showed this, that when you are excluded from the health services, because, for example, in the COVID time, many doctors' offices were closed, patients were not interested or worried to go to the hospitals because they were more worried about catching COVID than get the right quality service. Digital services came and helped, not always, perfect, but at least they try to fill the gap. So access was, I think, I really like keep eye on this, because access means also access to countries with less money, for people living, in desert medical areas, or in the countries when simply health services are not available. All specialized services, top specialists can be get. And of course, future is also about AI, about different tools they can help with this. But finally, when you go to the top of the system, of course, you need to keep eye on the public value of this digital transformation. And I think that this is what also kept us thinking that, you know, whatever we do, we should kind of balance this put the right balance between the you know, how we perceive the public values, but also how we implement in practice, and what is the right balance, for example, between private and public sector. We see a role for the private sector. I think we see this also often as a driver of change, but it should be balanced by these values and principles and ethical things. But I think on ethics, I will leave this to Barbara, because I'm sure she will tell us better, you know, how this was done. By the way, maybe just one document which also I can advise to read during the so-called French presidency for those living outside European Union. This is the period of 6 months when one of the European member states country is running kind of member states camp, and in last 6 months was France. And during this period, the French colleagues, they trigger work on the so-called ethical principles of digital health. This report is available. It's very well done. So very recommend to have a look on this. It's relatively fresh new stuff. So please have a look at it. Thank you.
Thank you so much, Andre. The report sounds fascinating. If you have it handy, it'd be great to share it with the audience, or if the JSPG team could maybe drop it in the chat, that would be great. Public values is a great segue to my next question, which is indeed for Barbara, which is in the context of trust. When we think about public trust architecture, which was, you know, a key thesis in the Commission's work, Barbara, could you help us understand a bit more about what trust means in this context of, you know, public trust architecture for digital health transformations, and data solidarity? How does public trust and data solidarity fit into this architecture framework that the Commission has embraced? And then Jyotishi, I have a question for you, building on the youth perspective related to this. So Barbara, on to you.
Thank you. Well, trust, of course, is a very personal thing. We did a study years ago, my colleague Susan Kelly in Exeter led it, where we asked research participants under what circumstances they would want to give, they would want to be asked for a specific consent for new research. And surprisingly, a very important or an unexpected finding for us was it really mattered to people whether they knew the researchers that were doing the research. It mattered more than other aspects. So trust is something very personal, very relational. And I wouldn't say that trust in data use is necessarily a good thing. Sometimes people have trusted too much. People in the UK have trusted the hospitals, and then those data were sold on to private companies. People trust companies, and then they do something with their data that they would not have agreed to if they had been asked. So trust is not an end in itself. The other side of trust is trustworthiness. So trust needs to be earned, and trustworthiness can be earned by good processes, by transparent processes, and also by including data subjects. You know, this is the technical term for people, for us really, for citizens, including citizens in decision-making, and not only in some kind of consultations where people can voice their view on what they want to happen. So this is what we also mean in data solidarity with collective oversight. So we want people individually to still decide where it matters to them, but always asking individuals to decide also has drawn attention away from the structural problems, from the ways in which we collectively need to make sure that data uses that are really unethical, for example, shouldn't go ahead. So at the moment, sometimes there's this this practice of throwing our hands in the air and saying, oh, this is also unethical. Maybe we should talk with the organizations. Maybe we should talk with the companies. We should ask them not to do this anymore. No, we need to crack down on things that are unethical. And so trust without trustworthiness, I would say, is not a good thing. And Anjay has mentioned this, and also Shalin and others, an important, in a way, criterion or one aspect of something that is worth our trust is the use of data that creates public value. And the €1 million question or €1 billion question is, what creates public value? If we went around the room, the virtual room, and asked each one of us, what is public value for you? We might end up with very different answers. But overall, and this is something that we're working on at the moment together with my PhD student Salim Al-Sayed, and I will actually leading an effort to create a public value assessment tool. So if you're interested in that, send me an email and I'll let you know more about this. But in a nutshell, what public value usually entails is that it doesn't, well, it makes people's lives better without placing undue risks on individuals and communities. So there's always a balance. And the more data use is likely to improve the lives of marginalized groups, vulnerable groups, and other sort of disadvantaged people in our societies, the more pronounced public value is. So if something just makes rich people even richer, this might be nice for them, but the societal public value of this is relatively limited. So all of those considerations need to go into the equation. And so if the use of people's data creates public value, that's one aspect that enhances trust and trustworthiness, but trustworthiness also needs more. To conclude, if we look at empirical studies, what do people around the world like to happen with their data? And here a shout out to my colleague Anna Middleton, who's leading a very large empirical study on what people want to happen with their data. I'll put the link in the chat. Overall, it's important for people that their data helps other people, either themselves or other people. And they don't mind that it also helps companies, but those profits shouldn't be obscene. And very importantly, the data should not be used to harm people. That's very important. So it's not only that people don't want themselves to be harmed or discriminated against, but they also usually don't want other people discriminated against. So empirical studies show that people are not egoistic, sort of self-serving people who just worry about their own individual privacy. They worry about what society we live in. And that's something that public value and also trustworthiness captures.
Brilliant, Barbara. Thank you so much. Just a couple of follow-up items there. If you have it handy, it would be great for, I think, the audience to have the link to the study you just mentioned on sort of suggesting that there isn't really this egocentrism when folks are looking to public trust in data. A part of what the audience is benefiting from in conversations like this one is sources for data and the latest in this space in terms of literature scans. And on that note, I wanted to ask one question to you, Barbara, or for others, if others know some examples. I love this point on effective collective oversight for corporations and frankly governments too that are using public data. Do we have a best practice that can be lifted up as an example for other countries or regions to use and look at that the authors of this call for papers might cite in their submissions to the journal? Would love to know if there's any great examples out there for collective oversight models.
So before, I'm sure other colleagues might want to come in. As you asked me, Shalin, the white paper on data solidarity that we will hopefully publish soon will have some examples in there, but collective oversight and control has many faces. One is, for example, national and also international and supranational legislation. So I mentioned earlier, if there's something that we think is so problematic, we shouldn't only use ethics to say, let's not do it, let's make it more ethical, but let's use law to forbid it. So here, some international organizations, but also the European Union, and I'm not saying this because Anshe is here, because I'm also very critical of some aspects of the European health data space, but the European Union has done a lot of good things in this direction, outlawing things that are unethical. And another example for collective control and oversight are real commons systems. So where people own data jointly and make decisions jointly on what happens, who can use it, under what circumstances can people use it. And collective ownership is quite important. It's different from an open access regime. Sometimes we're thinking, let's just make data freely available, but then often people who are already powerful and rich, they come and make the best use of free data. Collective ownership means that we can decide who can use it, who can't use it, who has to pay for it, who cannot. And in this way, we can realize just conditions of data use, much more than saying, it's all there up for grabs. Whoever runs fastest, whoever has the deepest pockets can take the most. So these are examples for collective oversight: data commons, national legislation, citizens associations, patients associations who jointly decide what happens with their data.
I love it.
But maybe just to add very, very shortly, this dilemma, who is the gatekeeper or controller of this access, of course, was quite critical also for us. We understood also from a number of experiments or ideas around the globe that there were projects that the people were asked to donate data, and then you will get your space. I'm not referring to any company because we have seen this in many companies. Finally, it didn't work. There was enthusiasm, it was reaching some kind of momentum, but then for one of the reasons, people stopped to connect and so on. Because people have this kind of thing. What we did, we tried to do this, to this gatekeeper role for so-called data access bodies. So there are institutions, a little bit like a problem with the bank today, and we somehow, we play a lot, maybe not all of us, but I don't think I don't play with cryptocurrencies, but normally in the bank, we always believe there is an institution behind. This is someone who has accountable for my money. I know at least, if I lost my money because of some transaction which was not authorized by me, I know that who is responsible. So this data access body, they have element, how we can access those data. One of the elements is also, for example, because we are speaking also to researchers, that you may need to present the ethical committee's authorization for your study. You can get access, but of course there are conditions. You need to go, for example, through the ethics committees, which is new thing because many ethics committees, they are not yet prepared, at least in Europe, to deal with those questions. So this is other problem. Barbara, maybe we should discuss also in our bilateral separately.
I'd love to bring in Jyotishi now for the youth perspective, given your expertise, Jyotishi. From your experiences, how do you think youth in particular can be a part of these collective oversight mechanisms that we've been discussing? And, do you have any advice for the folks writing policy papers for this call for submissions? What should they be thinking about to empower youth and give them true agency, not just, token voice, but real power in collective oversight mechanisms for data? Would love to get your perspectives or advice or things to consider for the audience.
Thank you very much for the question. I think, well, for us or for youth, it is something that it's intrinsically in our lives as we have been growing with these technologies, and it's also that we may not know how the world was before. So this is of course a different perspective. I think the first step is trying to organize this kind of youth initiatives that this journal is trying to promote. I think this is very, very important because first of all, we need this recognition that we are a population that's taken into consideration. Also because we need the support, we need this kind of workshops or webinars, and when we have ideas, we don't have, of course, a lot of, maybe some people don't have a lot of experience, or they don't have this same self-confidence of people that are more seniors. So I think this is very important, and trying to take advantage of these opportunities. When you see some open opportunity, please try it, please apply, because I think in every process we learn something. And I think this really empowers ourselves. Second, I think that youth should be also a stakeholder. There's always like the private sector, the academia, or civil society. Youth is also a stakeholder, and we should be taken into consideration in these under this framework. Youth should be there taking the decisions and also being there trying to contribute in the debates and in the writing or drafts of policies or technical assessments as well. I think we have also different experiences in our lives, and we can really contribute in these processes. I also think it's important bridging the gaps, being really, really thoughtful and conscious that there are different kind of youths. It's not that one youth in the world. We are very different within each other. So it is very different being a youth in some countries compared to others. If we are a youth in a developed country, we have way more access to a lot of opportunities. We know way more of, I don't know, like, yes, how can we engage or something, but, and this happened when I was a Generation Connect youth with ITU, because I was talking about, the research that we do, or how can we make this responsible. But at the same time, there was a youth from Panama, for example, that she said, it's very difficult for me to say this because maybe the youth here don't have access to devices, don't have access to technologies, they don't have access to internet, or they don't know how to deal with these technologies. So we really need to take this into consideration. And in the topic of health data, also, I think it's important to remember also the diversity, because in some technological innovations, the data is just considered from one area of the population, and maybe the data from other populations are not considered, for example, in terms of racial or ethnicity, and this can also influence the results that we receive. So I don't know, I mean, there's a lot of points that I could touch, but these are some of the points, and well, maybe later I can elaborate more. Thank you.
I loved your comments, Xiaori. and I also should give a plug. The Governing Health Commission does have a youth group on Facebook, and I encourage everyone in the audience to join. I've been digging for the link, but maybe if one of my colleagues who've had organized could share the link, that would be wonderful. Marwa, I have to turn to you now on this topic of youth engagement, because you were a co-author of the youth statement and the call for action for the commission. Could you elaborate a bit more on what young people want to see in the future of healthy governance and the importance of a human rights-based approach for health that folks in the audience could consider as they write their pieces for submission?
Thank you. And I think I'll just follow up on what Jordi already mentioned. I guess first, there is an important development that the world is experiencing right now. How we are currently moving into remote work, which already strains our mental health per se. So the meaning of well-being evolves and different meanings evolve. Currently, we are also facing, of course, the dilemma of climate change, which means even more emerging health issues within different communities. And what does it mean, again, for public value and fostering trust? When we talk about water scarcity, when we talk about also internet disruptions and the cost of being disconnected, because I don't want to assume that young people are digital natives, because they're not. In Africa, 70% of the population is shut down. So I think one of the youngest continents in the world is not connected. When the other part of the world is exploring the advent of artificial intelligence, we're still exploring alternatives for affordable internet connectivities and community networks. So I think how these conversations are really kind of in different edges. I guess it is, it's important to kind of decolonize the space, to assume that we're not speaking the same semantics, because other people, just like Jory said, are experiencing different things at different layers of vulnerability. Also, when it comes to governance of health data and how is it enshrined in digital governance, and how we're seeing at the level of digital cooperation that we're moving towards big tech governing big tech. And this is an alarming and concerning issue for the present and the future of health governance, in the way that, just like Barbara mentioned, the people that are at the status quo, they're benefiting the most from the status quo. And so how can we really ensure that everyone is benefiting at a decent state from the recent developments and the recent and the greater strides that we're making within the field, when, again, when big tech is governing themselves? And what does it mean for the sharing of data, third parties? And we've seen that during the overturn of the Roe versus Wade, and how people are, and especially young people, are wading through waves of disinformation campaigns, are AI-driven, automated, structurally designed within the systems that we use. And how can we really think about that in terms of ethics? But also, I think from the determinants of health, indirectly, when we talk about the economic, social, political situations in different environments, and this is not just about authoritarian or repressive communities, it is also about democratic countries where young people are hustling. They're, especially when we talk about early careers, who barely, they're at the wage of poverty, even though they make money, but at the end of the day, they can barely really attain their full health potential. And how we can talk about the taxing of health security in different states, even in democratic countries, and where people can barely afford the bare minimum, or they have to wait in long queues to get the appointment at the doctor. And so I guess all these questions really frame how we, and when I say we as young people, see the fulfilling of health as a human right in a decent way that that protects their dignity, and that helps them attain their full potential without having to hustle all day long. But also how we can talk about safeguarding without really restricting them, because when we because sometimes when we talk a lot of about protection, we give also states the kind of chilling effects on participation, and we end up just being tokenistic in the way we involve young people. So I think it's more about really participating as a stakeholder, like Jory said, but also admitting that the health sector is an echo chamber. There is a lot of traditional actors that are well established, and it's really hard to infiltrate and hack the space for civil society actors, for young people, for marginalized communities. So I guess without really accountability, to what extent we can say that we are meaningfully represented, and how we can implement these accountability mechanisms within an evolving space, with different facets and different power dynamics.
I absolutely love those comments, Marwa. If anybody ends up publishing a piece that connects workforce opportunities to our conversation, please let me know. I would love to read that paper as a labor analyst. Brilliant. I got a fascinating question from one of the audience members who's asked to share this anonymously. We've talked a lot about power brokers, people who have power and people who don't. The people who have power can call the shots, and the people who don't cannot. How does distributed ledgers and blockchain fit into this conversation? Do we believe that cryptocurrency and blockchain-based solutions are a way of increasing collective ownership, for example, and action here for youth? What does the panel have to say? It's an open question for anyone who'd like to jump in.
Do you want me to start?
Yes, please.
So the short answer is no. I think it's a grave mistake to assume that just because something is distributed, it's more democratic. Democracy requires some degree of organization. Justice, solidarity requires someone who ensures that people are treated justly, that enforce those rules as well. So just because something is distributed does not change the power distributions at all. So it just, in some cases, obscures them. So this is not to say that they should not be used at all. I'm agnostic here. It's not my field of research, but from a solidarity, justice, democratization point of view, absolutely not. It's not the solution at all. Democracy requires transparency, it requires public accountability, and distributed solutions do not enhance those values.
Yeah, I think it's maybe echoed a bit Barbara. It looks like opening doors for everybody. It will create more democracy. Unfortunately, this is a bit like a problem with the ships. You have all whites, but one of them could be wolf or even more, and they are creating the problem. Often when I discuss regulation, I hear you are over regulating, but I will say that sometimes our problem is to find the one black sheep, because this one black sheep can really destroy the whole system. So there's sometimes regulation is created to really make clear that we know who is white sheep, if I may continue to use this parable. So I think it's exactly it's good concept and interesting, could be employed in many areas, but we have to think about all these things Barbara already mentioned.
Gauri, Mara, any thoughts on this?
Yeah, I think that actually one of the comments that I saw in the chat is that, yeah, in order to be really democratic, people should be aware of what they are accessing, of what they are using. And the only way is through a process of literacy in these kind of topics. And how can they really comprehend and be conscious about these kind of technologies as well. So it's not that just, I mean, needs this kind of process and this kind of education in order to be democratic.
Yeah, brilliant. Thank you for the question. That was very enlightening, just even for me to hear from our panel. I'm grateful for it. Andre, I'm going to move to you for my next question here. The commission argues that any approach to shape health futures through digital transformation should be grounded in the same set of values built on solidarity, democracy, inclusion, equity, and human rights. What do you find is currently getting in the way of that approach for policymakers that the audience might consider addressing in their submissions?
You know, one area was I found very interesting in debates. You know, when we published this report, was about the is a digital health, digital world is a new type of human rights. I think that this is most probably most fascinating questions to me. I am not specialist in human rights, but I used to live in the communist country, and I remember for us the concept of human rights was very much, you know, about freedom, about get out of the cage, you know, created by the state, you know, get free universities, freedom of speech. Like somehow all these packages, I know now they are human rights. They were already somehow in our heads in our protests in '80s when we raised the Solidarność flag with like Valenza and followers. So this is what I think is a heart of the future debate. You know, how much this is the kind of new human rights, and I think this is of course for also new generation of users. Today I was sharing with my colleague experience with about Ukrainian families living now in my house in Poland, and I was fascinated by children, Ukrainian children continue schooling, you know, where they already are refugees, but they have access to the great platform, digital education platform, which allow them continue education, even be refugees in other country. So this is again built in my head of my past, you know, this is most probably the new human rights, because these people can be educated, continue to live the culture, they are connected to the teachers, they are also refugees, by the way, some of them. So fascinating moment. I think we really should see it, but I will tell also to the younger colleagues, because most probably this is your future, like I also discussed with my children.
Yeah, absolutely. Marwa, I know you mentioned the erosion of democracy as a really big concern here. Any comments on this? And I can restate the question here. You know, this argument that any approach to shape health future should be grounded in solidarity, democracy, inclusion, equity, and human rights. You know, it sounds like the erosion of democratic institutions and maybe even trust in democratic institutions, at least in the American context, is hindering that. Do any ideas come to mind that you might share with the audience so that as they prepared their submissions, they could address that challenge? Any research questions or any sources to look at or any perspectives to consider that might have been overlooked in the past?
Yeah, I think, well, I mean, it sort of comes naturally to me to just say that when we talk about access to health, we need to talk about controversial access to health. And so when we talk, for instance, about abortion as a controversial access to health, because I think, or because a woman thinks that she needs abortion because that's the healthiest solution for her. See what I mean? So I think this is really embedded in the right to express yourself as as a citizen, but also as a woman, as a non-binary, as a trans, as on the grounds of different economic, social factors. And this, of course, comes to light when you, for instance, work with healthcare providers or social workers or psychosocial service providers, when they don't understand why is it problematic to, for instance, to share private information about someone attained HIV or a woman who just got abortion in a restrictive environment, or why is it controversial to really talk about sexual reproductive health and rights in certain conditions. So you really go to the approach where humans can be protected, at least at the bare minimum. And I think the human rights-based approach is the least we can give to the health sector in order to ensure that people are that people at ease with the services that we provide, because they can be themselves while while accessing a service, because they're not afraid to come out, they're not afraid to really go and seek a certain consultation per se, just trying to really be more vernacular. But talking about democracy erosion, because we see a lot of shrinking of civic spaces, but we also see how in different instances of targeting human rights defenders, a lot of states, they use examples of, and it happened back in my country, Morocco, where a female journalist was targeted, and the government was using the fact that she got an abortion as to delegitimize her work. And people, they just started not trusting her sources of information, and she lost her platform on the grounds of the fact that she got an abortion, even though she didn't. And so just telling how it's really blurry to work within the health sector in general, without really assuming that a lot of strategies, whether anti-rights or nationalist strategies, really come from the right to expression, bodily autonomy, and just the right to see your best health the way you see it, without then a state interfere, without then someone would tell you how to do it. So I just trying to make it more exemplified.
Absolutely, Mara. Brilliant comment.
Can I,
Andre,
one idea which is for me quite intriguing, that during COVID, with many governments, this in Europe, all of them introduced the tracing apps to help, to define basically infection control, mechanism. And when we see now the results, how many citizens download those applications, you see that in Nordic countries, then generally the trust in government is higher. This download was much higher than in my own country, for example. It's like 65% to 5%. I am still, and then you can go country by country and see it. It is very intriguing to me to understand, this is one of these examples when the trust in government is basically showing the digital tool use, or maybe the people are afraid they could be used against them. So I think this is the one research area which I think we have to continue to work. Most probably in the States, we have very similar situation. There were states to states, huge difference also about the vaccine uptakes and so on.
Absolutely. Barbara, please.
So first of all, I wanted to thank Andre for highlighting what empirically is absolutely the key issue with contact tracing. It's not individual privacy. It's very often, again, this concern, what kind of society do we live in? So we see this in empirical studies. But I have a question for Marwa. So Marwa, I found all your contributions great, but in particular, I was intrigued by what you said last. And I wanted to ask you, you said we're losing a lot of civic spaces. Can you elaborate on this? In what ways are we losing civic spaces?
Yeah, again, I think because a lot of course, activism has moved in the online space where it's more regulated right now. I guess within, for instance, the Middle East, North African region, after the Arab Spring, the governments have really, I think they've just leveled up their games, and they just come to the fact that online spaces are no longer just spaces for fun or advertisement, but they're really spaces for mobilization. And we've seen that with the COVID-19 pandemic, where a lot of protests have been just shut down, where a lot of people, they haven't been able to mobilize or to have more access to peaceful assembly. But I think the shrinking of civic spaces currently is really is really coming with this turmoil that we're seeing worldwide. The prices, the inflation, the economic, social turbulences that we're experiencing all over the world, and how the power of people is being silenced, but especially human rights defenders, women's human rights defenders, and the usage of really targeted and coordinated defamation campaigns that really in disguise, that you can't even track them in the online space, because the government is really great at doing that, and because anti-state actors are really great at personifying you in a way that it makes you look non-legitimate to the public. So they use this again, like, what does it mean to have public value and trust and public trust in order to delegitimize you? And I was also part actually of a study here in the Netherlands during the elections among political leaders, where women political leaders have been even more defamated by their competitors, but also how Facebook has been not able to raise the reach of women political leaders versus the reach of male political leaders, because the system itself is, and the automated system is biased against women political leaders. And so, I'm just talking about how the shrinking of civic spaces is not really just happening at a physical manner, but it's really structured, and raise a couple of points that comes at the intersection of human rights, governance, and ethics, and how we can think about spaces where the more shifts happen at the confluence of power dynamics, since we're no longer in control, and since civil society is more often not included, even though we're the ones that stay in here when politicians, they end their mandates. We're the ones who experience and witness everything along the way. Whereas when someone runs for elections and they come, they're really just recently experiencing the space, but civil society is the one that sustains communities in times of crisis.
Brilliant comments, Mara. I'd actually like to add just one perspective to this question for the audience to consider. I think in addition to the challenges that people have being open about debates on policy issues online, there's sort of a behavioral shift that has been enabled by the digital environment. There have been studies that have shown that people are forming digital bubbles among themselves to be among like-minded people. They're deleting friends on Facebook or Twitter who say things that they disagree with. They're self-selecting news outlets that speak to their values and their views, and there's less of an opportunity to have challenging conversations and to challenge one's worldview. It's certainly been the case here in the US, where our former President Donald Trump formed his own social network to create one of these digital bubbles. So it'd be fascinating to see if any authors address that in their submissions to the journal as well. We're nearing on time, so on that note, I wanted to just ask kind of a wrap-up question to all four of our panelists before I turn things back to Adriana. We've covered lots of very interesting topics today, and no doubt the audience has sort of taken away a lot already, and many more will from the recordings posted online. But if you were an early career researcher in the audience right now or listening to this recording, what would you write about for this special issue? What would be your submission topic if you had to pick one? Maybe we could start with Jyotishi.
Hello. Actually, I was thinking about it would be interesting, for example, how can researchers contribute into the policy making? So the students or researchers could ask themselves, what is this topic of this maybe discipline that interests me, and that maybe I can make a contribution for something that it's a concern for me in society, that is a concern for me in how health data is nowadays managed. What is something that worries me about what my government is doing or what the private companies are doing, and so that maybe I could make this kind of contribution with something that really matters me.
Yeah, brilliant. Marwa, how about you?
I think I will be more keen on exploring surveillance practices related to health and how it really undermines the exercise of health. And I think although like state surveillance has been more kind of on the spotlight, a lot of sexual rights and reproductive health like related surveillance have not really been explored, which has always been used to control and restrict our bodies, but also the bodies of LGBTIQ people. And also we've seen that again with the Roe versus Wade. So I think just talking about governance, it's also interesting to see how it's challenged with algorithmic discriminations and harmful practices that really put users that identify as marginalized communities at the stake of potential adverse effects of surveillance. And I think one of could be one of the best examples, like the tracking apps, the menstruation apps, the sharing of health data to third parties, and who are they? Who are these actors? Just like mapping kind of the landscape, because the data there is not really clear. I think could be interesting topic to explore.
Most certainly. Barbara, on to you.
I really like the Jyotishi's suggestion as well, and obviously surveillance, as Marwa was saying, is important. What I would like to add is how can data improve something that needs improving? How can it make the world better, for the lack of a better term? And what prevents what are the barriers for this to happen now? So where could data actually make a difference, and why is it not happening yet? And the reasons could be that there are vested interests that prevent it. There could be, regulatory barriers. So what can we do to enable these kind of benefits from being realized? I think concrete examples of that would be very, very interesting for me to read, at least.
Yeah, absolutely. The case study approach sounds fascinating indeed. Andre, final word on to you.
So my okay, all are good. So I will advertise other ideas, which I think would be very critical for the future use of digital health products, especially because they're booming. We have many startups, coming with the new ideas, new products, and many of them, almost each of them, is saying it will increase access to health services, to health as such. So for me, it's very interesting if you can try to research more. How much is true. How much we can have those arguments. That digital health is really increasing access to health in the wider term. You can choose prevention or even treatments and so on. So mental health or maybe other things. So a lot of stuff is out there, understand, but I think it's more in the hype thinking than the real research. So I welcome this more study around this.
Fabulous. Well, thank you all so much, distinguished panel, for this extremely informative and really comprehensive conversation today. It's been a really enlightening opportunity for me, and I'm excited to dig into some of the links that you all shared in the chat. So thank you very much for this. Adriana, on to you for our closing. Thank you again.
Thank you all. It's been fascinating to be watching this from the background, learned a lot, and I'm sure the audience did as well. And thank you for the resources. We'll make sure to share those out with the recording prior to the deadline as well. Thank you, Shalin, for moderating, and all our panelists today. I'd also like to, again, extend thanks to GH Futures 2030 for partnering with us on this event, as well as the special issue. And we look forward to your submissions. Feel free to reach out to us if you have questions in the meantime as you're preparing. And thanks again for joining, and have a great weekend.